We are live now with Dr. Chris Reynolds, otherwise known as Dr. Wheatgrass. So what we wanted to do today, because we had an interview before, and there was a lot of interest in the wheatgrass extract and these different applications of wheatgrass. And I'm going to give you a quick case study of a person that I recommended this to, somebody who had bad skin in their back for most of their adult life. And it never cleared up no matter what they did. And then they used the spray on it. And then within about 4 to 6 weeks, I think it was totally cleared up for the first time in their life. So that's one case study that I know of personally. But what I wanted to do is turn the talk over to Dr. Wheatgrass, who's done a lot of research and a lot of great cases. And most importantly, he's come to wheatgrass because it's helpful and beneficial and reduces suffering for other people. So with that said, I'd like to say hello to Dr. Wheatgrass and welcome to our live broadcast.
It's great to be back after, well, it's been a couple of months now, I think, hasn't it? But you've done a great job for us, Joe, I think, in terms of, because I've had quite a lot of response from the last session, and a lot of questions, medical questions, which is what I'm after, because that's what I do. I'm not a marketer, and other people do that, but I just love working with the wheatgrass because of, as a doctor, it's made my life so much easier than it would have been otherwise, and particularly in seeing conditions like leg ulcers that don't heal, and even amputations that have gone ahead, that really you look at it and you think, well, maybe we could have prevented that. And because I think the mindset behind the treatment of such conditions is more physical rather than physiological, and that's where the wheatgrass comes in. It comes in at a different level, and it can actually help restore damaged tissue, but it doesn't restore anything, and that's something that we can perhaps talk about later on, and how it probably works, how I think it works anyway, after 27 years experience working with it. And it's people like you that are prepared to stick your neck out and say, well, look, let's have a go at this, let's have a look at it and see what it's doing. And I think from what you say, you're finding that it can be quite helpful to your patients.
Yes.
In certain areas, it's no panacea, but it's the closest thing I've ever come across to it in 37 years of medical practice, or longer than that, actually.
I think
completely changed my view, and when I first came across it, to the extent that my response was like I'd just been hit on the head with a sledgehammer. I couldn't believe what I was seeing, and that's what's driven me ever since. And I've had a pretty busy run in the last 27 years, believe me. But it's been the best run you could ever imagine, I think, for a doctor anyway, because I've seen so many people healed. I've saved so many people's feet from amputation. We've even worked in India, and we've been healing leprosy ulcers. We've just submitted a report on that. We had 7 patients with severe injuries or wounds that don't heal, that have 7 to 10 years, and we've just healed a lot of them. And from what I can read in the literature and everywhere else, there's nothing else that can do that. And we've only applied it to these patients once a month. In the early days, when I first started doing this, we did a study in India, and we had a man on a motorbike going around and treating these people 3 times a week. And some of them healed, but most of them, it was disappointing.
Huh.
But now, 15 years on, I can now look back and see where I was going wrong. I didn't really have any textbooks or anything that I could refer to where people have ever tried to treat leprosy with wheatgrass. I'm sure in India that has happened, and but because they use a lot of wheatgrass everywhere in India, growing in little pots, it's part of their culture. So it's taken me many places around the world, and particularly to India, where even we're saving people with ulcers that they're about to have amputations, and that's happened also in the West. From I've had a lot of patients coming through, in particular from the United States, for people with chronic leg ulcers, venous ulcers, arterial ulcers, etc. And we're not healing the ulcers so much as restoring the tissue to its normal state. But it's
I
not
think
the
that's
grass that's doing that.
yeah. I'd like to get a little bit more clarification because that's kind of the magic that's going on. It's actually what you and I talked about the last time. And by the way, for the people that have met you the first time, you're coming in from Australia, by the way, and you've been doing wheatgrass for 27 years, just to give a heads up for the people that are here. But in terms of that very specific detail, two specific details, I think that would be really good for people to understand. Number one, less is better sometimes, but number two, it's actually healing the tissue on very dramatic situations. Can you give us more information on that for the people?
Yeah, well, I think the first thing to say, Joe, is that it's not the grass that does the job.
Okay.
What the grass does, from my thousands of observations of healing, etc., over the last 27 years or something, is that the grass actually assists or notifies the brain of what's happening at the periphery, and not just on the skin. I'm talking internally as well, and we can talk about that perhaps later, if
Certainly.
you like. But I'm at that level now where I'm about to sort of lay down my theory and then and accept the consequences. Not that anyone's going to read it or take any notice of it, but the fact is I feel that I should write it down for at least to leave a message. And so maybe we could talk about that later in the piece, but I'm not quite at that point. I think perhaps if we can meet again in a month or two, I'll be ready then.
All right, everybody out in the audience,
Hmm?
that's what we want to talk about. We'll be back in a couple of months to get that what seems to be the most important part of this kind of a holistic perspective of how this works, and we'll get back to that as well,
Yeah.
because I think that's really critical. Because, like I say, from my own perspective, as soon as we met, I've been introducing this to people for a really long time, and always having very good results. As I said, even with a quadriplegic, with increasing, uh, you know, nerve awakening, I should say, and
Hmm.
other people like that. So it's really amazing stuff. So it's good to know about why it works and things. One of the questions, though, in terms of the dosage, so I think it's really important for people out there to understand because I know I got it wrong at the beginning. I always thought more was better. So can you give us a little bit more of the idea of how profound this is, that actually less is creating what you're talking about, that connection, and doing more might even be not as beneficial. Can you explain that to us?
Well, I suppose if I was in your situation, I wouldn't think so much it was profound, but more like crazy. But of course, that's been the most difficult thing to get across the point, and it took me a long time to realize that that was the
Yes.
way to go. And it was almost through clinical accidents, and no one's causing any problems, but I started to realize that the using less was best, and the less I used, the quicker these patients were healing. And there was clearly a significant change in the response. And it's not a thing that you overtreat with, because the way I see it is that it appears that the grass is, or the ligands in the grass are able to influence cell receptors throughout the body, both orally and topically, and that signaling goes on. It transmits the information at the periphery. Well, not so much that, but I wasn't hoping to get into this right at this time, but the point is that
That's okay.
I don't know for sure, but from what I've seen from thousands and thousands of patients and sitting down and thinking about how the devil can this be happening, it just I'm at that point where, as I said, where I'm able to answer that question, I think, quite well in our next meeting, because I'm on the but in a word, it appears that there's a breakdown in the nerve receptors at the periphery, and that if it occurs in sufficient numbers, it can create, for instance, abnormal skin conditions. Depending on what maybe it's a composition. It would be many different types of receptors.
Okay.
Like psoriasis, and if that breakdown occurs, you can't do very much. Often the treatment is topical steroids, but by using topical steroids, you're starting to erode what's left of the normal tissue under the skin, and the skin itself it gradually thins out completely. And what the grass appears to be doing is reconnecting, if it's possible. If it's gone too far, I don't think anyone can do it. It's like a stroke, a similar sort of thing. And once you've got a scar and in the brain and things like that, there's nothing you can do to change that.
Okay.
So, and I've got a couple of cases there where there's a young person with psoriasis, quite severe, and an older person where there's numerous lesions on the skin. And what happens with the older person is that there's of the lesions are dry and scaly, lacking nutrition or lacking nourishment, and they don't respond to whatever you do, and particularly if you put topical steroids on, it's not going to do anything, and could make it worse. And but when, how do I put this? It's difficult. I wasn't expecting this at this stage.
That's okay. If you want, we can go right into the slides. I think
that's all right. No, because I might as well get it off, because the yeah, I think it probably is, because I can see it in front of me, but being able to put it in words is not that easy, and I would prefer that we can perhaps go back to that later.
Yep. Why don't we go right to the cases, because I think a lot of people had. I mean, last time we talked about the actual, the leprosy cases and the different cases, and today we have for everyone a bunch of amazing cases, and the best part is we actually have pictures to show, before and after, things like that. So this is, I'm going to start to play the slides, and we'll allow Dr. Reynolds to actually give us an update.
All right. Well, this was a very early one, and I was in Melbourne at this stage. I'm living in Queensland now. And I had a clinic in Swanston Street, a Japanese clinic, because my wife's Japanese and I speak a bit of Japanese, and but it was a very successful clinic, because we were, in those days, there were numerous Japanese students, etc., and living in the city, so there was a demand for it. But this young man came in and he'd had this split in his lip for a year, and he'd had everything, steroids, antibiotics, you name it. And he had a whole list of medications that he'd had.
Sure.
And it was very painful. And he didn't go out. He locked himself up because he felt so embarrassed and mixing with his friends, and he couldn't smile without crying. So,
Wow. Yeah.
the poor devil. No, it's a very, very sensitive area. And anyway, I gave him a little bit of the cream, the wheatgrass cream, and I put a bit on for him, just showed him just to use a little bit as sort of heavy medicine. It's sort of very basic, but on the other hand, he came back a week later and he was smiling and he was very happy, and that's how his lip looked. Now, to a GP coming to see me, what would I do? What would I think about? I'd think about, well, what's causing this? And then, because you can't really think of anything, you have to start thinking, well, I don't know what could cause it, but how can we stop it? And then you'd have to say, well, we haven't got much, because there's really not much out of there. And the first thing I think the average GP, and I'm a very average GP, would look for would be topical steroids, because it reduces the inflammation.
Correct. Yeah.
And that's and it can work, but he'd been through all that. He'd been through all it, and it didn't get any better. In fact, it got worse. And now I can understand why that got worse, because those topical steroids are eroding the vital micro organs under the skin and in the skin, the receptors, cell receptors, etc. It wipes them out. So your signaling to the brain gets worse. And so you're actually inhibiting the healing process. And so what happened here with him, in my present state of mind as to how the wheatgrass probably works, is that a lot of these receptors were restored.
Okay.
And the messages started going back to the brain and telling them the brain that the wound is there. And but to get it in so quickly, in a week, was a shock to me. I just couldn't. And see, I've had thousands of these shocks over the last 27 years, and I'm not complaining at all.
Nope.
Because
that's a good thought.
He was a young kid. He was 17 years old, 18 years old or something, and in his prime and growing up, and he couldn't smile. And he had a hell of a smile, and especially when he came back to show me. And so, but it was on my mind for months, how on earth, because I had no idea at that stage what I was dealing with. All I knew was that it was safe. Otherwise, I wouldn't have been using it at all. And but now I've got a reasonably good idea of how that worked for him.
That's great.
But it's like any wound, if even infected wounds, you'll find if you put the grass on it, again, it's signaling the faults, not just the normal status, but the faults as well. Somehow that's getting through to here, and it's responding. And it really changes your whole way, well, certainly the way I see things when I see this sort of thing, and injuries or illnesses and things. I'm immediately thinking of how, what kind of receptors are involved in this, like in the gut as well, in the stomach, gastrointestinal things that we're taking it orally. Wheatgrass helps to restore these, providing you don't take too much, because I think the brain reaches a point where it just doesn't want to be told anymore. It's a very primitive way of putting it, but I'm not a scientist, but I do have a rough idea of how we work. But I've seen so many thousands of cases that I've got lists and lists of things here, and I've had, for instance, when I've got so many of them. That's right. One was one of the earliest ones. I'm not sure if I talked about this last time, but a female came in with a very high fever. Does that ring a bell? But she did. She came in with a very high fever. She was white as a ghost. She was about 27. She worked in the casino in Melbourne, where I was at the time, and she said, I feel terrible. I've got a shocking headache. I feel hot. I just want to go home and die. And she said, can I have a certificate? And I said, well, I can't give you one for that, but I'll give you one so you don't have to go to work.
Okay.
But for some reason, I just had some of this cream. And for some reason, I said to her, do you mind if I put some of this cream on the back of your neck?
Okay.
And when I said it, as I was saying it, I was saying to myself, who's saying this?
Oh,
It wasn't me.
oh wow.
Well, I was so anti anything herbal. I was brought up, I was trained to
Right.
to be just sort of not really accept anything along that path because it doesn't work. That's a huge myth, actually, when you think about it. Mm-hmm. And so something prompted me to. I said to her, do you mind if I put some of this cream on the back of your neck? And as I say, she looked for the nearest escape route, I think. And I rubbed some of this stuff on the back, and I was saying to myself, why are you doing this? You don't do this sort of thing. Well, I wasn't harming her, I suppose, but I examined her and she was fine. She sat down. She had a high temperatures, about 40 odd, but she looked pretty dreadful and white as a sheet. And so I sat down. She sat down next to me, and I said, "Well, I just started writing out her medical certificate." And I got halfway through it, and she said, "Doctor," I said, "what is it?" And I turned around and looked at her, and I looked again. I couldn't believe it. Her face had gone pink.
Wow.
Her colour had returned. It's like it was normal, and her eyes were bright. And then I said, "What is it?" And she said, "I don't know what you put on my neck." She said, "But I feel really good now. I don't feel hot, and my headache's gone, and I don't think I need that certificate." I said, "Well, I'm going to give it to you anyway, and off she went. But since then I've used it numerous times, especially on little kids with fever, and it's something that I mean. If you're a doctor and somebody's got a fever to the point where the mother has to bring it in, you actually look for other things just to make sure that there aren't other causes of fever other than a virus or a bacterial infection. Yeah. But at home, most mothers don't bring their children in with a fever. They just give them a bit of Panadol or Tylenol, what you call it, and they usually settle down. So it's the sort of thing that I'm glad I had it with my kids, because as soon as they started getting a bit woozy or a bit off colour or something like that, I just put a bit on the back of their neck, and sure enough, they'd be out there playing in the backyard again, in half an hour. So It's extraordinary. But when you think about what it's doing, it's somehow, well, why did I do that? Probably subconsciously, I'm thinking of the hypothalamus, but why would I think of wheatgrass cream and the hypothalamus? I don't know. I think it was just intuitive. It was just simple. It was just not even a guess. It was just something that I seemed to be prompted to do.
Wow.
And so that's something that I think that, frankly, most mothers and young children should be aware of. They can, but I don't want to get into a marketing area. I'm just saying about wheatgrass cream or wheatgrass extract is what does the work. Whether it's a cream or whether it's a spray or whatever, it's all the same extract. It just depends on how you want to apply it. That's all. Okay. That's the only difference. Or if you take it orally.
That makes sense.
So, so is that okay for that one? I'm not sure what we got a bit off track there.
That's okay.
Now, this is very, very appropriate. I think we've just been talking about this.
There's a hypothalamus. There you go.
You're pretty clever. So, and this has happened to me many times. And I remember I my first day in a clinic in Melbourne, because I was doing locums in different areas, because I just come over from Perth, I emigrated from Perth, and I was finding my way around. And I rolled up at this clinic, and it was a big one. There was 5 or 6 doctors working there. And there was a kid screaming his head off when I walked through the door. And somewhere in the building, I wasn't sure, and I thought, God, I hope I don't get him. Well, who got him? I did. And mother came in with this. He was about 2 years old, and he was screaming with the pain. He obviously had a shocking headache, and he was hot as hell. And I always had a lolly jar, you call it candy jar, little lollies in for little kids on my desk. And I took the lid off. This is my Reynolds test. I took the lid off and offered it to him, and he sort of pushed it away. So I said to his mother, do you mind if I rub some of this cream on the back of his neck? Well, you can imagine the look on her face, that she was sort of looking for the escape, where's the door sort of thing. And I could feel that. But on the other hand, I knew that it had worked for this woman. Yeah. And anyway, she said, oh, no, doctor, that's all right. And so I did. I just rubbed a little bit on and popped him up on the couch and had a look at him, and he seemed to be all right. But he was grizzly, and he was mummy, and I'm sort of hot and hurt. He was only a little kid. And so I sat down and started writing the notes and things. And then I got up, went to pick him up and bring him back, and I offered him the lolly jar again, and his hand went straight in there. And I knew that I'd won. And his temperature come back, and he was laughing and carrying on and running around the room.
That's great.
Well, that wasn't the end of the story, because he went out. See, it was my first day in this clinic.
Oh, wow.
Yeah, and it was my first patient on the first day.
Whoa, good job.
And I was living dangerously. And anyway, the receptionist came rushing in, and she said, what did you do with that little boy? And I thought, I don't think I killed him, but and I said, I just rubbed a bit of cream on the back of his neck. Oh, she said, I thought, well, who are you anyway? I mean, you'd be questioning what I'm doing, And I thought, well, I better play ball, because it's a big clinic. I don't want them all attacking me at the same time. The next thing, the boss doctor called me in, the owner of the clinic, and he didn't offer me a seat, but I thought he wanted to come in and just wanted me to come in and discuss the grass with him, and something positive.
Yes.
He said, what's this stuff you're putting on this kid's back, kid's neck? I said, it's just a herbal abstract, extract. And he said, well, either you stop using or you leave.
Wow, that's.
I said, well, I'm leaving. And I said, don't forget to pay me for coming out here. And he did.
Wow.
But that sort of summarizes a lot of the and understandable reactions from my colleagues. I knew that. I was well aware of that fact, because I knew how I'd felt, but I knew I was onto something different here, something I'd never seen before. I'd never seen somebody with, get a fever going like this, and I had 2 in a row here, and then I had a lot more after that. So it was that sort of that attitude I've had to deal with, which I understand fully, because had it been someone else doing what I was doing and I was still a GP, I'd be on that side. I wouldn't be on that side.
Right.
That's just normal. That's just normal behavior. All I'm trying to say is that there are alternatives out there. I used to poo-poo any alternative medicine. I did. But once I started doing this, I changed. Of course I changed, because people were getting better when before they weren't. It's not this isn't sort of rocket science. It's just, to me, it's observations and common sense. And in many cases it doesn't work, but there are many times when it does. And when later on, as I started using it in different areas, and I had a tremendous number of patients that had been ill for a long time and started feeling well again, or they're starting to move again, moving a leg or something. They were able to sort of improve their muscular movement, etc. Just by applying a little bit over the affected areas. I could talk about it forever, but we've only got a couple of days, is it?
So we've got about a day and a half. We got plenty of time. Don't worry about it.
Yeah.
Okay. One thing I think that people should do is you do have some amazing videos that I always send people to of your philanthropy work in the different islands and stuff like that show the kids with the clenched hands, the guy who learned who eventually could drive. In particular, the one with the clenched hands. I'm not sure if you're remembering the specific one that I'm speaking about. There were two that you have a video for. One is the child that had the clenched hands, and then you put on the cream, and immediately the hand began to open up right away. Do you recall that specific case?
Is that a child?
Yeah, a child in one of your trips to the islands for your.
No. That was sorry. That was no. That he'd had a stroke.
Okay.
No, he was in his 60s. And that was again another. See, I have a lot of these shocks. Thanks for reminding me of that. I was getting guilty about not doing any work or enough work in the field, and I volunteered to do a couple of weeks in a small village in Fiji, and that was a real eye opener, and it was a great experience. But my second patient that came in, because we're in a village, and because the doctor had arrived, the whole village came to the clinic. And it was a very busy day. But you get used to that in medicine. And it was so interesting, and such nice people. And but this man came in, he was hemiplegic. He couldn't walk properly. He had to, he had a stick, and he was walking on the side of his foot, and he was, completely paralyzed, and his hand was clenched up. There's a video of this on my site. I talk about this because it was fairly important in my view.
Yes, it was.
And he, I noticed I was still in a very early experimental stage with the wheatgrass, and I hadn't actually tried it on somebody with a stroke. And I said, do you mind if I put some of this cream on your hand? And when I was saying it, I was saying to myself, what are you doing? There seems to be some sort of voice saying, try this, try this. And I put it on, and I thought, well, yeah, okay. And he only had a cold or something. I had a quick look at him, and so probably 5 minutes. I said, anyway, let's see if you can move that hand. He said, I can't, doctor. He said, it's locked. I said, well, just try. I don't know what drove me to do that. And I said, okay, try. And he started moving like this. And it was slow, and he started moving, and his eyes were popping out. But so were mine. and this, he came out to a full open hand.
Wow, that's amazing. I think that video is one of my favorite videos of all your stuff.
Yeah, but put yourself in my position. I've just arrived in a small village. My second patient has just shown me a miraculous recovery of his hand, and of course it got around the village like crazy, and I was very busy for the next 2 weeks.
I bet.
But on the following weekend, we found I got one of the local drivers from the hotel I was staying in. He knew where he lived. He took me up to his place because he was hemiplegic. He couldn't. He had to walk with a stick, and he couldn't drive. But when I got there, I said, "How's it going?" He said, "Oh, it's good, doctor. I can move my arm now. I've been putting it on my shoulder." And I thought, this is too much. And anyway, we got him. I got him back to the clinic because he's still walking on the side of his foot.
Mm-hmm.
And I asked him not to put it on his leg at all. Let's see what could go. And I've actually got his wife to come, and she filmed me while I was putting the stuff, or a bit of the cream on his foot, around his foot and his ankle.
Yeah.
And you can see him standing up, and you can see his foot on the side, and then he starts moving across the ground. And as he's moving, his sole, his foot is going flat.
That's
That's
great.
how quickly it happened. Now, it's very hard to live with something like that. Believe
sure.
me, when you've got no one to talk to. And I was stuck out in Fiji and I had really no one to talk to. I called a friend of mine who was a neurosurgeon in Perth, and told him what I don't think I've ever felt so lonely in my life when I knocked off that day, because what am I dealing with here? It was a shock. And so I told him what happened, because I thought, well, maybe I can get some ideas here. And you know what he said? He said, oh, I've lost that one. I'm getting this, getting your president's problem, I think. But he, I know how he feels. And he said, double-blind studies, Chris, double-blind studies, and hung up.
Wow, that was it? That's all?
Yeah. Well, I mean, I didn't feel good about that, because I thought, well, at least we could have had a chat about it, and say, I mean, something has happened here. But see, there's been that barrier ever since. And for 27 years, there's been that barrier. But I can understand the other side of the barrier, because I was exactly like that myself. I was just blinded to anything else but essentially big pharma or modern medicine, right? There's some amazing stuff out there by big pharma, amazing stuff. There's no question about that. But there's also a lot of stuff on the other side of the fence. And I'm sure you know much more about that than I do. So, but anyway, I'm sorry about that. I'm sort of dragging things along. But is there anything else I can help you with, sir?
Nope, that's good. What I can do is go to the next slide here, and let's take a look, because we have some, I think people are going to be impressed with these different cases here.
Yeah. Well, I've been telling you a few miracles. Well, here's another one.
Yep.
See, this is happening while haven't got the faintest idea how this stuff's working. But I was over in India and in a burns hospital there, working with the consultant there was very keen to use it on burns, and on second degree burns, which is the only thing I ever recommend it for. It's no good trying it on third degree burns, because there's no means of contacting the brain, because the skin is so badly damaged.
Okay.
And that's a horrible thing to happen to anybody. This young man, we were in outpatients with a consultant. There were 2 doctors from the hospital, registrars, and there were 4 students from the UK were there as well. And he came in, and he was like this. I don't know if you can see, but he couldn't move his arms above that area, that level. And and I said to the consultant, I don't know why I did it again, but I said, can you ask him if it would be all right with you if and he's happy for me to put some of the spray on, some of the wheatgrass spray. And she was behind me. She was forward, she was very, very open-minded about it. And so I did. I sprayed him over all these areas over in front of his chest, etc. He was stiff. He just couldn't move, and his life was finished. And that took about 5-6 minutes. And I said to him, "Can you move your arm?" He said, "No." I said, "Will you try?" He said, "Yes, I will." And you could see gradually his arms were going up like this, and everybody's eyes were sticking out.
Wow, look at that. Yeah.
Particularly mine, because I'm forever saying in those days, what am I going to see next? But I'm still having that. Well, it's a good problem to have, but it's still happening today, because there's a very broad spectrum of conditions here that can be helped with the grass to a certain extent.
Yes.
So then there were other things that happened in that hospital. There was a little boy. He was about 2 or 3 years old, and he had severe burns all over the back of his buttock, and there was a big wound. And the consultant said to me, "Will you come and have a look at this kid?" And I said, "Yeah." And she said, "Well, do you think the surface of the wound was glistening?" I'd never seen anything like it, because you don't tend to see that in Western hospitals because of the antibiotics and the treatment that you usually get on it very quickly. It was a good hospital, but they were poor people, and they can only get so many days, free days. They got a few free days a year, sort of thing, in the hospital. And she said to me, this wound, it was glistening.
Wow.
And it was glistening because it was infected.
Yep.
It was just teeming with bacteria. That's why it was sort of, and I'd never seen anything like that. And she said he's going to die very soon because their parents don't have enough money to keep him in the hospital any longer. And he will go home and he will die at home. And I said, well, she said, "Do you think your spray might help him?" And I said, "To be quite honest, I haven't got the faintest idea." I said, "I've never been challenged like this before. This is a huge problem." The whole room was full of people. Really? This is India. This is medicine in India. Yeah. Yep. It's really a community thing. It's really a community thing. Yep. And his father was there, and he spoke to him. He said, "Well, you let the doctor put some of the spray on the wound." And he said, "Yes, that's all right. It's okay." And I went to one corner and just gently sprayed it once. And he jumped a bit. And then he said to his father, "I don't want any more." So he said, "I don't want any more." So the surgeon said, "Well, he's finished." And she contacted me the next morning. She said, your spray has saved his life. She said, overnight, the wound has dried completely, sealed over, and his fever's gone, and he's going home.
That's great. What a great story.
Well, it's great for the patient, but it's tough for me because I haven't got the faintest idea what's going on. And I've had this for a long, long time. And that's what's driven me for the last 33 or whatever, how many years now, I forgot, 27 years, sorry, that I've been working with it, trying to figure out what can explain this. And I'm sure had I spoken to a biochemist or a well-trained scientist or something, they could have told me. But I'm a bit different like that. I like to find out for myself. And also, I find it very difficult to talk to any of my colleagues about it because unless they were switched it on as far as what I was doing, that was just deaf ears. And I'm still getting that, but I don't worry about it because I see this kind of episode. I've had an extraordinary 27 years working with the grass. It's taken me all around the world to see so many different conditions that I would never see working in Australia. And this is a classic example. But the very fact that he could get his arms up like that, but nothing was ever said. There was no follow-up. Nobody said anything after the clinic. And I thought that was a bit strange. And you sort of get the feeling that there's a sort of deeply embedded anti-feeling about herbal remedies. And that's true. I know that's a fact from my own experience.
Right.
And because that's the way we're trained. But that was quite a while. That's why I put that up there. I thought that was quite I don't know what's happened to him since then, but the very fact that we've got that movement suggests to me that what we've done is restored that distal periphery, the periphery, or the senses that are now able to report back to the brain. They've been cut off for a long time. That's my sort of what I call my common sense view. I'm not a scientist, as I say, but I've always enjoyed that part of medicine it's like a puzzle, trying to work that puzzle out. What's wrong with this particular patient? It makes you, I'm sure you do the same thing. It's fascinating.
Mm-hmm.
And now I find in certain areas, it's no panacea, but it certainly works in many different areas. But if they've gone too far, or if their injury has gone too far, it won't recover. It's as simple as that. There's nothing. I don't think anything can do that. But as I say, with strokes that are and there's scarring, etc., in the brain, it's not going to help. Yeah. So
Let me I'll show you the next slide here.
This is my favorite area because it's such a huge problem, and I know it's very bad for the patient to have to suffer from this. It's also very bad for the doctor because it's extremely difficult to overcome this problem. And this patient was from South Africa, actually. His relatives contacted me and wanted to know if we could fix his leg ulcers, and because they were considering amputation because the circulation was so bad.
Okay.
They were worried about gangrene occurring, and then they'd have to chop the foot off anyway.
Wow.
And how is it likely to work? They asked me, and I said, yes, it is likely to work. But I didn't expect it to happen quite so quickly because as you see, in 9 weeks, there's an extraordinary improvement here. The question is, why does the varicose veins, why does the circulation to that area, why does it break down?
Right.
Well, again, this is a breakdown of cell receptors not being able to transfer or transmit accurately what's happening at the periphery, be it wherever it is, be it internally or externally. Once that breaks down, the brain shuts off because it's not being told. It's not getting the
right.
feedback that it needs to be able to react. And this one, well, they were, as I say, they were considering amputation because the ulcers were just going to get worse. Well, if you look at it from another angle, that if we can restore somehow the circulation, and there's lots of things that can happen to veins, to lymphatic channels, to arterial supplies, and in that periphery, in that sort of distance from the heart, can have terrible effects. And so this is something that I've done with or seen with many patients, but this was a very strong display, I think, of just how effective the wheatgrass can be. But it's not the wheatgrass that is returning the blood circulation to that area. All it's doing is signaling or restoring the signaling process. You know much more about this than I do, so I should get you to talk about it.
No, I don't think I can talk better about it. But from what I've learned from you is basically, as you say, if I understand this correctly, in the example, there's a lack of blood circulation, but it's not a matter of that the blood is deficient. It's a matter that the communication to the foot to increase blood circulation is deficient. Is that a good way to put it?
I think that's what's happened here. Is that, again, we're talking about receptors.
Yes.
And all blood, as you know, all blood vessels have millions of receptors. That's what keeps our blood circulation going. But it's all controlled by this, not down here. And it appears that, well, I think that, our Western style is to look at the foot and see what we can do with the foot. Well, there's not a lot you can. I mean, apparently it's about 1% of Americans have venous ulcers. That's huge. It's a massive number of people. We have a huge same problem here. And, well, it's globally. It's a massive problem, particularly as people are aging more, except you and me. And this, the what we're seeing again now is a breakdown of neuroreceptors, right? And they could be, I mean, there are so many different types of them just to control that part of the body. But in particular, the circulation, the microcirculation to the skin is severely damaged. And it just seems wrong to me that we approach it, but it was perfectly normal before I came across the wheatgrass, to treat that area. So what do we treat it with? We treat it with, say, tight bandages, which slows the circulation. We put all sorts of salves and mixtures and creams and stuff on it, which probably doesn't do very much for the skin. We elevate the feet, put pillows under the mattress at the foot of the bed. We encourage them to walk. We use, there are numerous approaches to helping these patients, which is extremely expensive. The nursing alone for these problems can be massive. Again, it is a nursing problem until the wounds start breaking down. The wounds start to appear and they get infected, and that can cause more complications, etc. And it's giving the patient one hell of a life. And but the question really is how do the veins break down?
Right.
A lot of these patients, they have varicose veins. The doctors just rip them out.
Yes.
Well, I think they should try the grass first and see if they can't reinstall the circulation.
Exactly.
And
yes.
That's it's not difficult. I mean, even I can do it. You put a bit of cream on this, but see, I had to learn again not to use so much, because if you put too much on or too often, it can have a negative effect. And this is a very important point. And it took me quite a long time to realize that, because to us, dosage is about extra, not enough. And we've been trained in that area. I don't know what it's like in your side of the fence, but in medicine, we see so much sort of interference with drugs and things like that. Some of them are marvelous; they're wonderful, but some of them can do a lot of damage, particularly the side effects. So
that's actually the question. The woman, we have a question. When you say use too much, I think you were answering that question here. When you say don't use too much, what does too much mean? It seems you don't want to overdose, and actually too much is not so good.
Oh, thank you very much. Thanks for the question. The too much is once a day, 3 times a day. Cut it back to once a month.
Wow, that's amazing.
For that, because you've got to do it very slowly. And see, it's very hard to get that message across in the Western environment, because we're three times a day at least, people.
Yes.
But here you're dealing with something it's not treating your foot. It's signaling to the brain that you've got that problem. It's a very different concept. And I'm surprised actually at this moment that I'm actually saying it to you in public. So I could get hung, strung, and what do they do? The pirates, they tie you to the mast and torture you, by my clinical colleagues. But I don't think that'll happen. Not today anyway. It's too nice a day.
Yeah,
but,
I think it makes sense, though, in terms of the anatomy and physiology, to to basically complete it, if it sounds to me in a simple way for me to understand it is that you're giving the body a nudge, and then the body is basically doing the heavy work and the heavy lifting once it has the message.
Yeah, it's a restoration. It's a restoration of the physiology, basically,
Okay.
that's been disturbed. And to me, there really shouldn't be any need for certainly amputation or for removing people's veins or anything like that. You need those veins. You need that venous return. It's a
Yeah.
normal thing, part of us, and we should be trying to restore that.
Yep.
And that can be done. But then again, if you overtreat it, the brain tends to shut down.
Wow.
It's like, I was going to say like you and me, but I don't have an ego. But sorry, I'm having a go at you. He's a nice guy. There's people you should look after him. I like him because he laughs at my jokes. But no, but seriously though, this can be fixed, and I would certainly not use it more frequently than once a month. Not in that situation. Not in any form of venous ulcers, and for people with venous problems in terms of circulation as well, you should apply that to the skin that's affected with that. And well, this is what's happened here. If you can go from what you've got there on the left to the right for a fairly damaged skin, if you've got a less varicose skin or affected area, you need to get onto that as a prophylactic, as a preventative, to prevent this sort of problem happening. And I think if your 1% could be cut back very quickly, and so could ours.
That's great.
But not often. But don't overtreat. That's all I can say. It's just people are so tempted, and naturally, I'd do the same thing. I'd be slapping it on 3 times a day. But you don't. It's not necessary. Once you've made that contact, you'll start to see. Well, can't say in every case, but certainly in most, if not all, the cases I've treated, you start to get recovery. Some don't recover completely, but at least their quality of life improves.
Yes.
And they're not forever bandaging up and having smelly, stinking wounds and things, sort of upsetting themselves and everybody else. That sort of, it's an awful thing to happen to people.
And I think it's good. So just to recap for this one in particular, if you didn't intervene, he would have lost his foot. So I think everybody needs to understand that within 9 weeks, his foot recovered and there was no amputation. Is that right?
Yeah. What does it say? Think about making that contact.
Correct. Yes.
Or restoring that contact, and. But don't forget, I'm a slow learner, and it sort of took me a long time to recognise these things. But better late than never. But without even knowing or having any reasonable theory on how it worked, I was still using it and getting good results.
Yeah.
But I've been through that phase where you're putting 3 times a day, etc., and you can't hang on. That's not working. It may be getting worse. Why is it getting worse? Well, because your brain's just shutting down. It doesn't want to get involved anymore.
Right.
But I know it sounds corny. I know. To any doctor, they probably think that I'm, I should have read more medical books. But the thing is that it's really quite basic.
Yep.
And I think that the simpler you keep your approach to medicine, the better.
I think the key is that you can't dispute the evidence here, and I think that's one of the best parts about. And I appreciate you coming back and showing us more of the actual evidence. You can't argue against results. I mean, people may be curious, like your doctor, your boss before that you worked for one day, I mean, they have to at least be curious, but you can't dispute the evidence. I think that's the bottom line. I'm hoping that people will take away from today. We're showing this amazing evidence of these different cases for people to understand how amazing this really is. And this is one that you gave us here today, which I thought it's just like incredible. So if you could tell us about this one, that would be.
Well, this is one of the most extraordinary things I've ever seen. Is a young American child, or child in America, I should say, and she was born with an omphalocele where her intestines sort of forced their way through, basically into the, or through the umbilicus, through the belly bone, and I won't get into the details of that. But what's happened is this child has been in hospital for a year.
Wow.
And the mother's been visiting her child every day for a year. She sent me an email and asked if the Wheatgrass would help, and I said, I have to be very honest, I haven't got a clue. I don't know, but it's worth a try.
Yep.
And that's what happened. As you can see there, 8 days after, and you can see the difference between it's like a reddish area here. So a lot of this is inflammation.
Yes.
And the abdomen is fighting to force the intestines back in and to cover it over and to regrow itself. So it's inflammatory, it's being pushed, etc. And also the skin is very thin there, so the blood supply can be seen through the wall. But I spoke to her mother, and we conversed by email, and she put the balm over it with the doctor's permission, and she was home 8 days later.
Oh.
So that saved her a year's. Well, she was expecting another year to attend the child every day, and so there she is. She's home 2 weeks after. She's on a swing. Some of the other photographs there, she's looking like a very happy, joyful young girl.
That's great.
I feel very good about that. But I just put that there as that's an exceptional type of, or very unusual place to be. But it just shows you not so much that the wheatgrass is healing, but it's messaging. Or it's reopening the messaging, because nothing's going to fix that to the point. You see, what's happened is the child's skin is not as inflamed, and it's strengthening. The doctors must have seen that to be able to send her home, because that's what they were worried about. They didn't want that to burst open again, but they were planning another year in hospital.
Wow.
And so I'm very proud of that one. And I get a hell of a kick out of these things, believe me. It's worth working all day for, because I suppose it's more like a passion than anything to me. But I've got hundreds, probably thousands of these cases now. That I've got plenty more time to talk to you if you've got time to give it to me. So, all right.
I think that was the last picture, and let's see here. We'll remove, and let me set this up here so people can see you better. But anyway, I think the key is, like I say, picture's worth 1,000 words. But these are real cases with you, and they're really fascinating. And again, I'd like to have the opportunity to speak with you some more, to continue on our conversations, because it's so beneficial to people. But I think the key is that people need to be curious, and they need to be open to the possibilities of this, which you've learned from experience. And one thing you say, you repeat, that you're a slow learner, but you're a fast healer, because your intuition was fast, but your science mind caught up later. But your intuition was amazing, and you help people without even the knowledge of the way it works. So I'd like to say that people should really learn a lot from that example, that, you felt from your heart that it was going to work. And guess what? It did. And you've been doing it again and again.
I get a hell of a kick out of it, believe me. But look, I really appreciate your time here, Joe. You've been very kind to me. You've been fair and not too, outrageously vicious or anything like that. I'm used to it anyway. I could handle it, you know. But
Well,
no, I just love seeing. And when I was that little kid, and especially kids, you know, when you see them getting better, you sort of think, well, you know, that's really worthwhile, and it does happen. And so I hope we can meet again soon, if that's all
yep,
right with you.
I'd
And
love to do it again. I'm
I
willing
can't
to do
believe an
this.
hour has gone already.
I can't believe an hour's gone already, but I think we gave some really good information, and these will be repeated because this is the real deal here of exactly what's happening. And for myself, I'd like to also agree, tell everybody out there that I've been using this for a long time, from a quadriplegic, skin problems, people put it on their knees, all kinds of things. And yes, I would like to just collaborate or condone what he's saying, that this is amazing. And I think it really needs to be, I think people need to pay attention to it. And I think that's my goal, that people really listen and pay attention to it. And thank you very much for sharing your knowledge and your wisdom in these great cases. I appreciate it very much.
Well, thank you very much. I notice you're not wearing a mask.
Uh, Good question. But
Have
I'm in
you
a,
noticed I'm not either?
I think we are socially distanced. You're in Australia, I'm in the US. So I think we have social
Yeah,
distance.
1.7 meters, I think.
Is
Well,
that
big
always
fun
so?
talking to you, Joe. Yeah, thanks very much, and I look forward to chatting to you anytime because it's sort of.
Before we go, I think we need to tell everybody that's watching, how do I think the website is grassfactor.com. Is that correct in the United States?
That's grassfactor.com. Yeah.
So that's
She
where
was
you can
one
get,
of our earliest. She was our first overseas importer, and that goes back 18 years,
oh, great.
17, 18 years. Yeah, and so it's yeah. Well, you've been you're quite an intelligent young man, you know.
I'm smart enough to listen to you. That's how smart I am.
You're all right. You're what we call a good bloke.
Thanks, Val. And then also to find out more about your amazing history, that would be drwheatgrass.com.au. Is that right?
No, it's mine is wheatgrasshealing.info.
Okay.
That's
I
my
wasn't even
website.
close.
Yeah. That's the place to go. Don't go to the commercial side. I don't talk about
Okay.
products. I talk about problems in wheatgrass extract. And so yeah, info at wheatgrasshealing.info.
So
Yeah.
I recommend everybody to go there because it has a list. You can look up dozens and dozens of
Oh,
actual.
just search on your condition, and if you've got a question, just send me a message and I'll get back to you. Promise.
And that is actually true. He does that. That is true. So again, thank you very much for this opportunity. And yes, I want to do it again. And we'll just keep doing it and get the word out there. And I
Yeah.
appreciate this opportunity. So
Yeah. Well, I'm 80 now and I've got nothing to do. It's like hell.
nothing to do but save the world. Oh well.
I'm very busy. No, that's next year.
Next year. All right. We'll okay. We'll catch you next year.
Okay. Yeah. Well, thanks, Joe, and thanks again. And I'll try not to keep it so long next time.
No, this is perfect. This is exactly right.
It's all right, is it? Yeah.
Yep, it's exactly right.
All right. As they say in Japanese, "Kyotsukete." Take care of yourself.
Okay, you too.
Yeah. Thanks a lot. Bye.
Bye now.